Hi, welcome. We are talking today about how you don and doff your PPE. Okay, what is donning and what is doffing? So, talking about donning and doffing, you're going to hear that a lot as CNAs, as nursing students, and as nurses. Everybody in the healthcare will have patients that are on isolations and patient with COVID or some very, very advanced respiratory diseases. So, you're going to have to be donning and doffing your PPE. So today, what are we talking about? So what do you need for that process? So you need a gown, number one, okay? We have our gown here. So before you get started, anything and everything, remember you have to do your hand hygiene, okay? So you get your sanitizer, sanitize your hands always, okay? And then you get to wear, okay? So this is what your gown looks like. If you're new to the healthcare field, like I was, everything was new for me. That's why I'm here to make it simple and easy. So you can watch this video as many times as you can to get you ready for your clinicals, for CNA, for LPNs, and for RNs. Okay. So this is what an isolation gown looks like. Okay. It has an opening in the back and it has these cords here. Okay. So this is how you wear your gown. Okay. So some of them will come with these holes in here. So this is how you put them, and some will not, which is fine. Okay, and then you get to put your head. All right. So step number one. Then you have to make sure. So you grab your ties, turn around, make sure it's all tied up in the back. Okay. Step number one. Step number two, you're gonna go ahead and wear your mask. Okay. So this is a simple mask. Depending on your patient isolation status, they can just be droplet, they can be contact isolation, and if since it's COVID, everyone wants to protect themselves. So this is a simple mask that you just get to put on, like so. Your patient is on any type of droplet isolation, and then you put your mask, these in the back, okay? Okay. Number two. Then if your patient has airborne isolation, that's going to be for COVID or TB. So you're going to need your N95, and you usually get tested for your N95. Okay. So how do you get to wear your N95? So here, like so. So this is how you put your N95. Make sure it's snuggle on the level of the nose, and also there are two strings. This one string is all the way down and the other string is midway, okay? Just to prevent any particles to enter, your respiratory area. So for the purpose of this video, we're just gonna use this simple mask. And this is how you remove your N95, okay? All right, so after having your mask on, your gown on, your mask on, let's say that your patient is on airborne isolation. Depending on the type of isolation, usually it will tell you what you need to be wearing. So if you need a face shield, this is what a face shield looks like. Okay, so just open it up and wear your face shield. And all of this is done before entering the patient room. And we're going to do the last part, which will be wearing our gloves. So make sure you get gloves that fit your hands, because when you're learning, you're all stressed out, you'll be sweating and you'll be fighting with your gloves. Okay, you don't want that to be happening. And this is how you wear your gloves. Okay, this is what your PPE looks like. So now that we're done. All right, so this is the part where my microphone let me down. So I'm all PPE'd and it's time to remove your PPE. So you are doffing. So I'm going to show you two ways that you can get to doff your PPE, your glove, your gown, your face shield, and your mask. Okay, make sure that to remember that your gloves are the dirtiest part of your body. So you remove your gloves first, okay, and then you start from in and you remove it out. Okay, you don't touch the dirty part, and then you turn around and remove the gown from the back, because the back is it's kind of cleaner than the front. And then once you get to the front part, you can rip it off. Okay, and then I'm going to show you my second way. That's my favorite way of doffing. So I'm just, for the purpose of the video, we tying my gown, wearing my gloves, and I'm gonna show you. So I feel like this is the easiest way because you get to do all in one and you have less contamination. So you get to just rip off your gown, rip it off completely, and start removing it from your body, and make sure you fold it to the front from the dirt to the cleanest part. Fold, fold, fold. So you take off the gown and the gloves at the same time and you trash it. So I like doing hand hygiene in between. So I'll sanitize my hands, and then now I'm going to remove my face shield. Okay, with my clean hands, I'm removing my face shield. I'm touching my face, and then the glove, the mask will come last. So that's how you get to doff your PPE. And then just remember, you always do hand hygiene after all. So if your patient was C. diff, you wash it with soap and water. Thank you so much for being here. I hope that you learned from this video and you come back for more. Make sure you subscribe if you're here for the first time, and also follow me on my other social medias such as TikTok and Instagram. Love you. Bye.